welcome to Harbor Media's Health Highlights, where we will discuss an update on the COVID-19 pandemic nearly 2 years after the first cases were reported in the United States. Our special guest today is Dr. Daniel Kuritzkes, Chief of Infectious Diseases for Brigham and Women's Hospital, noting that Brigham is a founding member of Mass General Brigham. And he's also the Harriet Ryan Albee Professor of Medicine with Harvard Medical School. Dr. Kuritzkes, thank you for joining us today, and we appreciate your time and expertise as we discuss where we are now with the pandemic.
It's a pleasure to be with you.
Excellent. Can you tell us a little bit about your background?
Sure. So I'm an infectious disease physician. I went to medical school here at Harvard. I trained at Mass General, then was at University of Colorado for 12 years before coming back to the Brigham now 20 years ago. I'm a virologist by training. Most of my work to date has been in HIV, working on improving treatment for people with HIV and understanding how the virus becomes resistant. But of course, like so many of my colleagues in the last 2 years, have pivoted to COVID-19.
I understand why it has your attention. It has our attention as well. And that leads us to some interesting statistics of where we are just about 2 years after the initial onset of this virus, and then some questions. According to the Center for Disease Control's data tracker, we've had 53 million diagnosed cases of COVID in the US. And unfortunately, we've had greater than 800,000 deaths since mid-January 2020. And within our own state of Massachusetts, we've had more than 1 million positive COVID cases and greater than 20,000 deaths. So Dr. Kuritzkes, what are you seeing in your own practice in terms of cases, the severity, and then have there been changes in the profile of those who are most vulnerable to life-threatening experiences?
Well, so this is really a tragedy of national and international proportions. We have seen significant changes over the course of the 2 years. At the very beginning, the people most likely to be affected, and certainly those most likely to die, were elderly. The early stages of the epidemic just really tore through residential facilities, chronic care facilities with older, really fragile people, as well as elderly people in the community. What we've seen more recently, and this is, I'd say, it was really over the last year, is the number of cases has shifted dramatically to younger people. So whereas in the first 6 months of the pandemic, we saw mostly older people becoming infected, after that, it was mostly people under age 50. That probably reflects much more cautious behavior on the part of older people who were more concerned, perhaps. You know, the fact that younger people are more likely to be out and about, especially in crowded settings like bars and restaurants where they may encounter others who are infected. Most concerning has been the shift to an even younger population. And so in the last 6 to 8 months, we've seen up to a quarter of the cases occurring in children and teenagers, which again reflects the fact that up until recently, they couldn't be vaccinated and were also more likely to be out and about.
Yeah, and that really leads us, you know, to our next set of facts and questions relating to the vaccine. Nearly 2 years into the pandemic, we've had nearly a year has passed since the first availability of the vaccines, followed by, I think we're about 6 months of booster availability. The CDC is reporting that more than 205 million Americans are fully vaccinated and approximately 66 million are boosted. So, you know, Dr. Kuritzkes, what have we learned about the protection that vaccines and boosters offer, and how does that relate to these breakthrough cases? Should we even be calling them breakthrough cases, which are people who are testing positive more than once, even after they're fully vaccinated? Are the variants responsible? What can you tell us about these scenarios?
So first, it's important to remember that when the vaccines were being tested, they were tested to demonstrate their ability to prevent people from developing symptomatic infection, not necessarily to prevent them from becoming infected, which is a pretty high bar for any vaccine. Polio vaccination and measles vaccine, for example, we don't PCR people for those infections. We know they don't get clinical polio or clinical measles. But we know that these vaccines are highly effective and remain highly effective, particularly in preventing people from developing severe disease that requires hospitalization and from preventing people from dying. And the data that the CDC has cited on many occasions are that the vaccines overall have resulted in about a tenfold lower risk of, meaning a 90% reduction in your risk of requiring hospitalization if you happen to get COVID, and a 13 times lower risk of dying of COVID if you were have a breakthrough case compared to somebody who's unvaccinated. We've seen data just recently from Israel showing that boosters similarly have a dramatic effect in reducing the risk of death from people who had breakthrough cases compared to those who only had 2 vaccinations. And this was principally with the Pfizer BioNTech vaccine. So all of the data really show the incredible protection that vaccination offers despite the occurrence of breakthrough cases.
Yeah, personally, I have to say we're just a week or so past the winter holidays, and I know of 6 families who had at least one family member isolating during the holidays because someone was positive. And then recently, very recently, the CDC announced a change in protocol for isolation from 10 days to 5 days, and then an update very recently this week. Can you share with us what information that we've learned so far in this pandemic process, and then what went into making the change from a 10-day to a 5-day isolation protocol? And are there certain cases where this new protocol would actually not apply?
Yeah, so I think the principal data that went into the CDC recommendation that people could come out of quarantine after just 5 days if they have no symptoms is that we know that within a 5-day period from symptom onset, the risk of transmission drops substantially. And so by 5 days, there's a very low chance that somebody might still transmit virus. And so if you continue to wear a mask when you're out and about, then that really brings that risk down to 0. And I think that that's the most important aspect of what the CDC recommended. Yes, you can go out after 5 days, but you have to do so with a mask. Now, they clarified that a bit earlier this week by pointing out that this means you really shouldn't participate in activities where you can't be masked. So you shouldn't be going out to restaurants, you shouldn't be going out to bars. And it'd probably be a good idea if you didn't travel, like on an airplane or on a train where you were going to be with other people for a long period of time, unless you've tested negative.
Right. And I think that a lot of people were waiting for that clarity, and I think it made a lot of sense to people, and it's nice to hear that official clarification from the CDC. And I'm not sure if you have anything to offer too about the type of mask, because there's been some updated information on what kind of mask people should be wearing.
Well, I mean, you really want to be using a surgical type mask, which has multiple layers. I see too many people who have what look like bandanas that have been repurposed as masks or flimsy cloth masks. You really ought to be using a surgical type mask, and ideally a double mask, because we know that that provides better protection for yourself than if just a single mask.
Yes, and that leads us to our next section here. So let's talk about the prevention and spread of COVID-19. As we speak, the federal government is making more than 500 million at-home COVID tests available. How important is testing in the prevention of spreading COVID-19? And how does it compare to other measures, some of which you've already talked about: vaccination, mask wearing, social distancing, monitoring your temperature and symptoms, and even hand washing, which we talked a lot about 2 years ago?
Yeah, so I'd say in the hierarchy of things, vaccination and wearing a mask are the 2 most important things that people can and should do to prevent themselves from becoming infected and to protect others. I think testing can be useful because if you are going to visit vulnerable individuals, say you're going to visit a household where there's a young child who can't yet get vaccinated, or an older person who's immunocompromised and might not have responded to their vaccine, then if you test before going because you've been in a situation where you might have been exposed, that would help to provide some reassurance. I think testing is most helpful when people have developed symptoms, and you need to know whether those symptoms are COVID or something else, because we also have flu that's circulating. This last week, there's a particularly nasty but standard cold going around, and many people have been out because of those symptoms, even though they've tested negative for COVID. So that's where the testing is most helpful.
Yeah, and I agree with you. I mean, we still have flu, we still have these nasty colds, and one thing I've noticed, people are being very diligent about getting tested when they show symptoms. And I think that that is something that the public has learned in the past 2 years, is to take your symptoms and your body, your own health awareness more seriously, especially before visiting someone who is extra vulnerable.
And particularly in the workplace, I realize this is a real economic hardship for many people, but you don't do yourself, your coworkers, or your clients or customers, depending on your setting, any favors if you go to work sick with a respiratory illness, because then you're likely to spread it. Whatever it is, we need to work on providing systems that make it easier and more feasible for people to stay home without losing pay, so that we can encourage people not to come to the workplace sick.
I agree. In our own television studio, we've discovered we do a really good job working remotely and just limiting our exposure to each other, lessening the number of people in the studio, and we still continue to crank out the work, and that's what we're doing, just because we can, and just take that little extra bit of precaution. So let's talk about another form of testing that I've been reading more about, and I'm seeing covered more for the public. And it's become more available without a doctor's order, even. And that is COVID-19 antibody or serology testing. I believe I'm saying that correctly.
Yep.
Whether it's from a vaccine or booster protection, or from folks that have recovered from one or more, we can now say, cases of COVID. What does antibody testing tell us? And is there a role for that information in preventing the spread or severity of COVID-19?
Yeah, so antibody testing is much more controversial than testing for COVID itself. So there are two types of antibody tests. The most common test tells you whether you've been exposed to COVID or not, and that can be helpful. It was actually particularly helpful in the first 6 to 8 months of the pandemic, when we were still ramping up testing, and many people had an illness that they thought may have been COVID, but didn't have an opportunity to get tested yet. And then if they found that they had antibodies, they could say, yeah, I probably did have it. Sadly, we may be back in that situation if people can't get hold of a test in time, and then a few weeks later they get an antibody test and confirms that, yes, you did actually have COVID. The other type of antibody test looks for antibodies specifically against the spike protein, and those in theory could be used to determine if you had responded to the vaccine. But it's important to note that the FDA has not approved tests for that purpose. And we don't know just how much antibody you need to be protected. And so it's hard to interpret those results as far as whether someone has a protective level of antibody or not. And that's part of the reason the FDA has been slow to approve them for deciding if you need another booster or if you still need to take extra precautions despite having gotten vaccinated. I'm hopeful that as more data become available, we will get to a point where the spike antibody tests can be used to help provide better guidance to individuals about their particular risk. And this is especially useful in people who are receiving any kind of immunosuppressive medication where the vaccine may not generate as strong a response. And it is potentially useful as well in identifying certain people who may benefit from particular treatments for COVID, which are best given in those who have yet to develop an antibody response.
And as a physician and researcher, specific to virology, can you draw any conclusions from other scenarios, other viruses where it does show up with antibody testing and then offers a level of support? Is there anything we can learn from other viruses and antibody testing?
Yeah, so the best example is actually for hepatitis B virus. Healthcare workers are routinely vaccinated, and first responders are routinely vaccinated for hepatitis B because it's a bloodborne infection that you can get from a needle stick, for example. And we know that there is a minimum threshold for the antibody level that's needed to have protection. And so not all the time, but in certain settings, we will test for antibody. And if the antibody is below a certain level, then people get re-immunized in order to ensure that they have an appropriate antibody response.
Thank you. In the past 2 years, we've seen some progress and actual promise of therapeutics to assist in the treatment of COVID-19 cases. We're starting to hear a lot more about those therapeutics now. Can you share with us about, I feel like there was kind of a timeline of antibody donations from recovered patients that seemed to be used in the beginning of the pandemic versus monoclonal antibodies that we've heard a lot about in the past year in availability, as well as these new COVID-19 medications?
Yeah, the progress in COVID therapeutics has really just been astonishing in terms of how rapidly drugs have become available and proven to be effective, with at least one of them now having complete FDA approval, and that's remdesivir, and several other agents having emergency use authorization. You're right, at the very beginning, there was the thought that maybe if we could take plasma or serum from people who had recovered from COVID, that they would have antibodies that might be helpful to people who were first becoming sick with COVID. There have been a large number of trials, and they've generated mixed results. The majority of the studies have been negative, with only a couple showing promise. And the challenge is, first, you need to know that it's high quality plasma that's being used, plasma with a high titer of neutralizing antibody. Secondly, it has to be given really early in order to have an effect. And that's probably why the studies were less promising than had been hoped. But a much more refined approach, although it took a little bit longer to get to, is the use of the monoclonal antibodies, which the analogy I like to use is it's a difference between drinking a blended scotch and a single malt. So, everybody who gets infected makes antibodies. If you could take a cell that produces those antibodies from somebody and find the cell that made the best antibody, and then clone that cell so you could mass produce the antibody from that cell, then you'd have a monoclonal. And that's exactly what's been done with the whole series of monoclonals that have come along. And they've proven to be quite effective. Now, the problem with monoclonals is that they usually have a pretty narrow specificity. And so as the virus mutates, a monoclonal that may have been useful against alpha or delta may not be so helpful against beta or Omicron. And that's why we're seeing some of the antibodies that were used, say, 6 months ago have been found to be less helpful now. And some of the newer antibodies that have just become available show promise against Omicron. We also have had major progress in more traditional kinds of treatments, what we call small molecules, meaning they're things you can give as a pill or give as an injection. And those, as I mentioned, remdesivir was the first to be approved, but now we also have molnupiravir, which has some activity, but is certainly better than no treatment. And then the combination of maltravir and ritonavir, it's a two-drug combination known by its trade name Paxlovid, which is highly effective, although is just getting released into use now.
So what I'm taking from this is there's been a lot of progress, and it's more important than ever to keep your doctor in the loop who knows your personal health history and what therapeutics may be helpful to your particular case.
That's exactly right. I think the thing that all of these agents have in common, and it's true in influenza as well, is when you're trying to treat a respiratory infection, the earlier you initiate treatment, the bigger the benefit is going to be. So you really do want to reach out as soon as you have symptoms and test positive to be able to get treated. But it's also true that some of these drugs are better suited to certain types of people than other drugs, particularly because of some drug interactions that may occur with other treatment people may be receiving. And so it really does need to be thought about carefully by the individual's healthcare provider or by an expert who can sort through the different issues.
Thank you. There's been some discussion, whether through having COVID-19 or being vaccinated, about whether or not myocarditis or pericarditis are associated with these infections or vaccinations, and if so, for different age groups. Can you speak to what we know from research so far, and what else have we learned about COVID in the past 2 years in terms of what might be long-term effects on our health?
Sure. So we do know that although COVID is primarily a respiratory infection, it really has a myriad manifestations throughout the body, and it can damage the heart. And that it does so by either directly infecting heart muscle or infecting the cells that line the blood vessels. And so myocarditis, which is infection of the heart, or pericarditis, infection of the lining around the heart, certainly have been documented to occur with COVID, although fortunately they're not very common. The mRNA vaccines have also been shown to have a noticeable but very, very rare, on the order of 10 or 20 per million incidence of myocarditis. Studies that have been done show that the risk of myocarditis from the vaccine is far lower than the risk of myocarditis from COVID. So you're still better off getting vaccinated than taking your chances with COVID. And the risks for the vaccine are greatest in young men. Late adolescent, early 20s, but they're still on the order of 17 or 20 per million. So it's an exceptionally low risk, and even in that age group, it's still lower than the risk of getting myocarditis if you became infected with COVID. As far as more persistent effects, so I should emphasize that the cases of myocarditis with the vaccine have all been mild, and those symptoms resolved without any residual damage. We're still learning about long COVID and the long-term consequences. There's certainly been a lot written about and talked about people who have persisting symptoms even months after COVID, with persistent mental fog, shortness of breath, fatigue, muscle aches and pains. That resembles what we've seen in some other viral infections, notably mononucleosis, where we have seen the so-called post-viral syndrome. We have a very poor understanding of the mechanism causing that, which unfortunately means we have a limited understanding of how best to treat it. And because we're still learning about COVID and its after effects, it's going to take time for us to get all the information and data that we need to be able to know how best to approach this. The good news is that for the vast majority of people who do have these persistent symptoms, they do eventually resolve, although it may take much longer than most people would like to see. But people should realize that they will continue to improve over time.
And that's why it's a novel virus. It's new, we're learning. And we appreciate you taking the time to answer these questions. Is there anything else you'd like our audience to know?
I would just encourage everybody to get vaccinated. Do your best to convince your friends and family who may not yet be vaccinated to get vaccinated. We can bring this pandemic to a close if we can ensure that we protect ourselves and our communities, and it's really a shared responsibility. And so that's the message I'd like to leave people with.
Thank you so much. We really appreciate it. Thank you for sharing your time and this information as we continue to navigate life while living through this pandemic. And I wish you all the best, happy and healthy year. And I hope that you'll come back and talk to us again.
Well, thanks very much. Happy to help out.